Hi, everyone. This is a video on newborn screening. If you're not going to watch anything else this week, watch this one at least for the first 5 minutes of it. It will give you help on your newborn screening project. You do not have to reinvent the wheel. It does not have to take you more than about 20-30 minutes to complete the entire project. Working in groups, it might even take you less time with what I'm going to show you. So here's some information. Sorry, didn't mean to do that. On newborn screening. Every newborn in the United States is offered testing for disorders that can be treated if detected early, preventing disability, illness, or death. Most of the things that are tested for are inborn errors of metabolism with autosomal recessive inheritance patterns, common examples of which are the PKU, which was the first disorder to be treated, cystic fibrosis, which is a more recent addition, sickle cell disease, common in African American and Hispanic populations, congenital adrenal hyperplasia, rare but treatable, and spinal muscular atrophy. So most of these babies look healthy at birth, and there's no other cheaper, better way to diagnose these disorders. Because they're autosomal recessive and because they are rare, people sometimes don't know that they have a family history of them because they're not mating with other carriers. And then it happens one time and you've got a life-changing event. But because those babies look healthy, they aren't always picked up until it's too late to prevent irreversible damage. So each state has different screening mandates. For example, Hawaii only has about 28 conditions. They are the state with the fewest disorders screened. Connecticut has the most with 75. Most states fall somewhere in the middle. Pennsylvania and New Jersey both have about 60. Here is where you're going to get your money's worth from this video. Did not take us long to get here. See this link? Let's click on it. We end up with a page that gets us to the HRSA website. Sorry, I'm scrolling. Now, you have each selected a condition. Go to Conditions Overview, and it will give you all of the things that I asked for in the rubric. You might have to look up a few things here and there, but not many. So let's say that you chose classic galactosemia. That's a great one. It will give you information about that disorder. It is estimated that fewer than 140 babies are born with this condition each year in the United States. It tells you what the disease is all about, how we screen for it, what happens after. You can pop open any of those little plus signs to get more information. So babies with this condition can have serious health problems if they're not diagnosed or treated quickly. And that involves a special formula that is low in galactose and lactose. It tells you about inheritance and family concerns. It tells you about signs and symptoms. It tells you what the cause is. It gives you information about resources. It tells you how to treat the disorder. Everything that the rubric asked you for is on this one page. And since you're splitting it between 5 people, I mean, if you're really good and you're focused, you could get this project done in minutes. It could have been an in-class activity. You're getting 5 points towards your grade for it. So you're welcome for that. And now if you want to turn off this video, you could, but you'd be missing a lot of really good information. So to qualify for an inclusion, the state looks at disorders that have a low-cost screen. It can't be some $500 test for a single gene. It's not something that can be found by just looking at a baby. That's always cheaper to use your eyeballs than to prick a baby and send it off to a lab. So Down syndrome would not show up on this screen. It has to be a condition that's serious enough to cause severe health problems early in life and impact growth and development. It can't be something like a risk of diabetes in 40 years. We'd never stop screening people, and it would get costly and not necessarily helpful. It has to have an effective treatment, and within your state, you have to have some way of helping these people find the treatment. Okay, so the nurse's responsibility in newborn screening. So there's 2 things. So if you're a maternal newborn nurse, your job is going to be to collect the sample. Anytime you do anything to a patient, especially a newborn, you have to talk to that family, right? If it's a newborn, you have to get parental permission to do anything to their child. Most hospitals that do maternal child, most home birth midwives that I know, will provide a nice fact sheet about the value of screening, the conditions that are detected, and where they can go for more information. As the newborn or maternal newborn nurse, it is your job to collect that sample carefully. They will reject it for anything. My God, I worked in newborn for 5 years when we had a newborn nursery. Now it's all mother baby, and I'm labor and delivery, but they will reject anything that they think will give them an inaccurate result. And then it will be your job or someone in your department's job, and they will not be happy with you. That person will have to go find that parent and bring them back for screening. The parent will not be pleased at having to come back to the hospital to do something that was done wrong. And the infant needs to be stuck again. And more importantly, you have delayed treatment by X amount of days for a child who's at risk for something that could be getting treatment right now, especially those inborn errors of metabolism, where if we change a formula, we get normal health, growth, and development. But if we allow them to continue breastfeeding or offering regular milk-based or soy-based formula, that child has a lifetime of disability. So you don't want to delay anything, and you don't want to inconvenience the parent or stick the baby more than once. Do your job right the first time. Make sure that all of the information on that little card, I'm going to show you a picture of it, is filled out thoroughly, accurately, that you are timing the screen according to the directions provided by the state. All of those things are super important. If you do it right the first time, you can save lives. One little mistake, and this is sometimes a really tedious job, but one little mistake, if you work night shift and you put in the wrong date because they were born at 4 minutes after midnight and you still have October 22nd in your brain, but it's now October 23rd, that can delay treatment for this kid. It's important. You could save a life by just paying attention to what you're doing, even with those really tedious jobs. Another part of this could be that if you are in that role, especially in public health departments or in pediatric care, you could be counseling patients about what the positive screen means for them. Sometimes it's not diagnostic and they need to be referred for further testing. Sometimes it is diagnostic and they are offered treatment. So that could be part of your role, and you have to be familiar enough. And that was the point of our project. So here's the card. Fill it out thoroughly, accurately, legibly, exactly the way that you are trained to do on orientation. These little circles here, this is the tough part. So generally, when I do these, I haven't done them in a few years, but I can still do them. Swaddle the baby with one foot sticking out. Put a heel warmer on that baby so they bleed really well. Give it 3-4 minutes while you're explaining the procedures to the parent. You could be doing the congenital heart screening at the same time. Provide some kind of pain relief, whether that's have a parent put on a glove and let them suck on the finger, whether it's a pacifier. Sometimes you can use this for short term, doesn't really interfere with breastfeeding. Some doctors, if parents are really reluctant to allow you to stick their baby, you can get an order for Sweeties, which is a little bit of sugar water. That seems to provide some pain relief. But good swaddling, generally they might for the first stick and then they're fine. The big thing is that you have to fill these circles out completely. You cannot have an area that is still white, and you don't want to go really far beyond the circles, because if they overlap, that creates a problem for the machine that reads them. If I were to flip this over onto the back, you would see these circles are also on the back. You have to keep checking to make sure it's a filter paper, so it starts in the middle and then it kind of spreads. Make sure that the back is also completely filled out. And that is how that works. So parental refusal, it's uncommon. Most parents will go, do whatever you have to do. It's all for the good of my baby. But some parents will refuse. And even though it's mandated, most states allow refusal on religious exemption. I don't know of any religions that specifically forbid newborn blood spot screening or hearing screening or congenital heart defect screening. But people don't have to disclose what the religion is. They don't have to provide documentation. They just say, my religion won't let me do this. Parents who refuse, though, should be informed of the consequences of their decision. This is where I want you to take a look again. This is Pennsylvania's form for refusal. I'm going to blow it up right here. what you want to read out loud to this parent so that they know what they're signing. Use an interpreter and document that if you need to. I accept full responsibility for the potential outcomes, including serious illness, disability, or death. Use the D word with people. And a lot of times they'll go, wait. What do you mean death? I thought you were just doing the hearing screen. And you go, no, well, that's important too. But you're accepting this consequence that your baby could die because of something you decided. And you knew that the risk was really minimal. If they say that's fine, I decline it, they have to check off which particular thing that they are refusing. They sign and it releases the state and the hospital from liability. They were educated, they were given an informed consent, they refused screening. But we don't have to get too adversarial. Don't just hand them a form and say, okay, sign right here. Find out what their concerns are and listen. Use those motivational interviewing skills that I know you learn in other courses. Motivational interviewing could look like, so I see that you are opting out of the newborn screening. Can you tell me more about your decision? And they might go, nope. And that's fine. Okay, I tried. That's when you hand them that form and say, okay, let's go through. You understand these are the conditions that are tested. You could be putting your baby at risk. If you accept that risk, sign here. And then you document. But sometimes they'll tell you, well, I don't want you to stick my baby. It hurts. And my last baby was so fussy, and I looked at his little foot, and it just made me cry all the time. People have baby blues, it's hormonal, um, and they can fixate on stuff. And you say, well, okay, so your concern is pain. Can I talk to you a little bit about things I can do to reduce the pain your baby experiences? And sometimes they're receptive to that, and sometimes you can turn a no into a, can you give me a few more hours to think about it? Or sometimes a yes. So, you know, listen to what the parent's concern is and address that concern. And if they still refuse, you do your due diligence, but you tried. This is important. And here's why it's important to do newborn screening. So, more than 13,000 infant lives are saved or improved as a result of early detection and treatment of conditions that are part of the newborn screening. So, if we catch coarctation of the aorta in a CCHD, we don't send a baby home who 5 days from now might decompensate and die. We can refer that baby to a pediatric cardiologist. If we catch a hearing loss, we can refer to treatment so that that child has a chance at normal communication. We don't wait until they're 2 or 3 and they're not responding to their name, and the parent goes, oh, maybe I should get their hearing checked. If it's a child who has an inborn error of metabolism, we could prevent irreparable brain damage. So these things are important. The cost of the screening, that $5 an infant that was quoted to me on the internet, easily regained by preventing intellectual disability, severe illness, death. It's worth $5 an infant. Parents can be referred for genetic counselors, clinical geneticists, and then they can be helped to access services, even people who are undocumented and ineligible themselves for Medicaid. If their baby was born in the United States, which, of course, this is the population we're talking about, that baby is entitled to medical assistance and other programs because that baby is a United States citizen. People don't always understand that. And they don't understand that their child is entitled to help. If there's an issue with transportation, the baby can be referred to services like Access Link so that transportation to appointments are available. Disease tracking systems, registries facilitate collaboration among professionals and lead to better outcomes. If you're studying cystic fibrosis in the state of New York and you're getting good outcomes with a particular treatment regimen, sharing that information in a nationwide registry or database means that somebody down in rural Arkansas can access the results of your work and try it themselves. That is the end of newborn screening, and we're going to end here. Thank you very much.